Thank you, everybody, for coming. And I'm Alexandra Garnier-Mercier with the ADRC, the Alzheimer's and Dementia Resource Center in Central Florida. And we have with us Dr. Cook, and we're going to talk about hope for the future, the brain bank, and what we do. Thank you. With that said, Dr. Cook.
So we are talking about hope for the future, about brain donation, and we are doing a shared presentation with Alexandra. And we hope to discuss a little bit about brain donation. And first thing, I want to quickly introduce you to my team and to the director of the Brain Bank, Dr. Dennis Dixon, and the co-director, Dr. Melissa Murray, and all our funding agencies. So Alzheimer's disease is the most prevalent dementia. There are other types of dementia, and it's expected to have a significant increase in cases in the prevalence in following years. And this expected increase is due to several combination of factors. For instance, age, and older, however, a higher proportion of older adults will present a higher prevalence of Alzheimer's disease and other dementias. Also, it's also well known that African Americans and Hispanic populations have a higher risk of developing the disease. Cardiovascular health is also highly associated with dementia risk. Conditions like hypertension, diabetes, and obesity are strongly linked to increase of dementia risk. And other genetic and biological factors, such as the presence of a gene variant, which is well known as the most genetic factor that increase dementia risk, is ApoE4. People that have that variant will have an increased risk of developing the disease, but will not necessarily develop it. Overall, genetic mutations that determine the disease are rare and account for less than 1% of all cases. The good news is that risk factors are considered modifiable, so we can take action to reduce risk and potentially prevent the disease. So, age well, physical activity, nutrition, diet, balanced diet will help decrease the risk. Avoiding harmful habits such as refraining smoking, excessive alcohol will decrease the risk. And also social connections, interactions, activities to promote mental and emotional well-being is going to help decrease the risk. So under the dementia umbrella, there are different types of pathologies associated here or under the same umbrella because they share the same kind of symptomatology. There's a lot of overlapping. But by studying the brain tissue, the autopsy brain tissue, we know that it's well known that amyloid and the presence of amyloid and tau are the hallmarks of Alzheimer's disease. So if you observe the tissue and you observe the presence of and the accumulation of tau inside neurons, such as these ones, or the presence of plaque in the brain tissue, amyloid plaque, such as this one, or this diffuse one, are hallmarks and always present in all cases of Alzheimer's disease. But other pathologies, as well as in Alzheimer's disease, other brain tissue changes can be observed. So vascular changes or the accumulation of other types of proteins such as TDP43, nuclein, and even neuronal loss, brain atrophy, the shrinking of the brain, are evaluated. So the brain tissue analysis is what the autopsy report will tell us. So the autopsy report is a detailed analysis of the brain tissue, and it provides critical insight to these brain changes. And by doing this and combining this with the medical records review, the pathologist is then going to reach a definitive diagnosis of the pathology that is the cause of death and also associated co-occurring pathology that may be also affecting the individual. So the clinical diagnosis may still change after the autopsy report is reached the definitive diagnosis. And this happens because several changes observed in the tissue in the autopsy report presented. These changes are not detectable during life. So after the autopsy report is completed, the brain tissue is going to be the fountain for and allow a lot of scientific discoveries. Brain autopsy tissue has been involved in all drug development for treatment of dementia and Alzheimer's disease, and the development of different types of biomarkers. And I'll give you some example of successful biomarkers in drug development that use the brain tissue. The goal is to stop the disease and hopefully find a cure. So, for example, the imaging biomarkers. So, there are specific traces that we're developing and validating brain tissue, such as amyloid and tau tracers. They can be highlighted in the presence and accumulation and can help and support the clinical diagnosis. Also, the development of drugs such as anti-amyloid drugs were also studied in brain autopsy brain tissues to help develop and evaluate its efficacy and also side effects to further develop better medications. Fluid biomarkers is another example. Proteins found, amyloid and tau found in blood or even in the CSF, the cerebrospinal fluid, have been developed by comparing and being validated using autopsy brain tissue. And also, genetic biomarkers and genetic features are discovered by using this type of tissue. So the brain tissue becomes an invaluable resource that allows these scientific discoveries. At the Mayo Clinic Brain Bank, we maintain carefully about almost 12,000 brains, and it's helping contributing to families by sharing the autopsy reports with clinicians and families. Also have helped and supported discoveries of biomarkers of drugs, and also plays an important role, an educational role for physicians, for families, for students. It's an invaluable source of information. I want to highlight here the importance of these autopsy reports and by sharing Spark. Spark is a documentary that is available online. I'll share the link to get to it. And we have the privilege to have Susan Williams visiting Mayo Clinic. And she was talking about this documentary, but she also shared how meaningful the autopsy report was to her. And in her own words, I finally found my husband's killer. So science is always evolving, and certain research is our daily work. And by opening a conversation about brain donation, we hope to raise awareness and provide a deeper understanding of its vital role in advancing healthcare that benefits us all. To share a little bit of numbers at the Mayo Clinic Brain Bank, we receive brains from across the country, and in the state of Florida, our partner, Alexandra, and her team is the top county in terms of brain donations. So cheers to Alexandra. She'll be with us in a minute. and share more information about this. So, about again, numbers to show you about 2024 donations, we received 490 brains. Most common pathologies were Alzheimer's disease, followed by Lewy body dementia, progressive supranuclear palsy, and others, and neuropathologic gene pathologies and primary diagnosis. We also observed that most common mixed pathology is Alzheimer's disease and the combination with Lewy body dementia and vascular changes. Overall, in 2024, Alexandra and her team contributed with 37 brain donations, and the Mayo Clinic Alzheimer's Disease Research Center with 19 of these donations. So with that, I hand it over to Alexandra to explain about how to become a donor.
I'm Alexandra with the ADRC. We are the Central Florida Brain Bank. I cover with my team, and Barbara is here with us. She's our coordinator, and we cover 21 counties in the state of Florida, and the rest of the counties covered by Mount Sinai Medical Center in Miami. And all the procurement that we do, we send all the brains to Mayo Clinic, and Mayo Clinic will do the autopsy. But we coordinate all the procurements here, and we can start with how to become a donor. And I'm sure that some of you, you have either clients or people you know, caregivers around, they may ask you, how do I become a donor? And just have to do a complete application packet. It's not complicated at all. You have to have a consent to do the research. It has to be signed and the authorization to do the autopsy. It's very important. And we have to gather the medical records. And with that said, the individual has to be over 18 with a diagnosis of Alzheimer's disease or any other forms of dementia. And that diagnosis needs to be in place for at least 12 to 18 months. Because if you have been diagnosed like 6 months ago, we will not be able to proceed. It has to be 12 or 18 months or more. And you have to be diagnosed by a medical professional, not your next door neighbor. It's not your neighbor saying that, oh, you have memory issues, you have dementia. No, we need the diagnosis from the doctor. You have to go to either your geriatrician, your neurologist, your primary care, who will give you diagnosis. And we know around Florida, we have different memory disorder clinics. You can go to one, or you can, if you're in Martin County, you can talk to Donna True at the Council on Aging. She'll be able to guide you. Or wherever, if you're here in Orlando, we'll be able to refer you to Dr. B, Dr. Valdivieso, or Orlando Health, or Dr. Visa in Brevard. It depends where you are. If you don't have the information or where to go, just call us and we'll be able to provide you a list of neurologists, neuropsychiatrists, or geriatrician to help you. And you may also have, or the person you're caring for may have cognitive impairment, and that's okay. You can apply with the brain bank. You can be involved in the process as well. Or they may not have any memory issues. Maybe you are very healthy. You have a normal brain. I can say normal, Doctor Dr. Cook. I don't know if we are all normal. We have a little bit of craziness in ourselves. But yeah, you can become a donor if you don't have any memory issues. That will allow the doctors to do some comparison pertaining to a healthy brain and a brain affected with some form of dementia. All right. So, what is a full neurological workup? Yeah, you have different components. The doctor will ask you about your medical history when you are filling out the paperwork. Family members may have had memory issues, but were never diagnosed. those, but you can mention that on the application. We will ask about the patient past health condition and present health condition. We will gather the family history to determine the patient's symptoms and when they first appear. Because the family, when they come to the clinic, they will say, I observed some changes with mom or with dad like 5 years ago, but he was going to work and continuing. For me, I observed the change with my mom probably 5 years ago, but she was functional. She was able to do her EDLs and IDLs. And suddenly after that, wow, it was very catastrophic. So you will see those changes and remember the brain start to change 15 to 20 years prior. So that is something that show you how important brain donation is, so we can find out or develop better equipment to find out early what is going on. So why the full neurological evaluation? Because the doctors, they have to rule out certain diseases like UTI, and you can suspect that. So it's very important to do the blood work, the full neurological evaluation. Maybe you're anemic or you have a vitamin B12 deficiency. Maybe there is a tumor in the brain or, that they can address that will reverse the symptoms of dementia. Thyroid's problem, drug abuse, depression, severe depression can show that. Diabetes that is not treated properly. So all these, they need to rule them out. This is why you have to go to the doctor. They have to have all this blood work done. Procedures for the autopsy. Okay, the brain coordinator, like here, we are 24/7 on call. The answering service will reach Barbara at any time. Unless she's on vacation, I'm on call. Wherever we are, they will reach out to us. And then we will make the arrangement from where the person passed away to the hospital where they're going to do the procedures or to the care center of the funeral home. The process, the family, they don't need to be worried about the process or what is going on because we will take care of it step by step. Okay. And we will arrange for transportation. We'll take the body from where they passed away to the hospital, to Arnold Palmer Hospital, Orlando Health. And we have a team of doctors on call who will do the procurement of the brain and we will send them to Mayo Clinic. Dr. Cook mentioned that they will provide a neuropathology reports to the family. As soon as we receive the neuropathology report, we will inform the family and we will send that information. And usually, the neuropathology report is done within 6 months of the autopsy. When they did their finding or their studies, it will be accompanied by a letter explaining everything. Any discrepancy with the antemortem clinical diagnosis are explained in the letter. And it's very important because the family, when they receive it, they will know, oh my God, indeed, my mom had Alzheimer's disease. Oh my God, my mom did have Alzheimer's and Lewy body, and we didn't even know that. And with that said, we ask the authorization so we can send the neuropathology report to the doctor or the doctors who were following them while their person, their loved one was alive. So it's really a great tool for the doctors as well. They can review, what did I miss? Or did I have everything? Did I look at everything? And it's not like the doctor really missed. It's sometimes the insurance, what the insurance had allowed them to do as scan, or what type of lab tests that they needed to do or not. And things that maybe not available yet. Maybe it's only research company that can provide this type of test. Just to let you know, it is very important as well for the doctors. Okay. So usually what do they ask? What does the autopsy of the brain entail? A brain autopsy involves a single incision at the lower back of the head, allowing for an open casket at the funeral if the family chooses. Okay. And does the autopsy delay the funeral arrangement? No, not at all. The examination is done soon after we are notified of the patient death. The procedures is completed within hours, and we work with the funeral director or the cremation company in order to expedite the transition of the body from the medical center to the desired funeral home for services or any other arrangements. And if it is in the west coast of Florida, usually is the care facility of the funeral home. They provide the site to us, most of them. They provide the site to us free of charge. If not, we will have to look at grants or donation to see and cover it. But we don't let the family cover it unless they had done their prearrangement and they had said, oh, we will take care of it, don't worry. Because they know that everything we do, again, is free of charge. Who can legally authorize an autopsy by signing the autopsy permit? Who can do it? We have different people. The spouse usually is the one who signs it, or the person who has and if it's the spouse, has to have the durable power of attorney, healthcare surrogate papers, or is the guardian. Or if not, if it's the daughter, adult children, or friends, they do have to have the durable power of attorney and healthcare surrogate. And we will review all the paperwork that is needed. And what is the cost associated with the procedure? There is no cost involved, and we mentioned that before. The family is only responsible for the cost associated with the pre-planned funeral arrangement. We encourage everyone to plan ahead of time, and Barbara or other folks can let you know that sometimes we receive last minute phone call. My mom died this morning. I would like to donate a brain. Or my mom is about to die tonight. Or they are saying that we have a short time before she passes away. So therefore, I would like to donate. So we at the brain bank here, we cannot do that immediately unless you have all the paperwork. We can email you and you provide us with the medical records, sign the authorization to do the autopsy, you do the application. If we have that, it will be able to proceed. And in the application packet, we need the scans, the narrative that mention, yes, we did the scan, an MRI or PET scan, whatever scan of the brain that they have done. If they were not able to do the scan of the brain due to some implant, like they had heart problems and they had a monitor then implanted. So if they were not able to do the scan, we have a series of questions that we have to ask. And also we take the documentations of the doctor and we can proceed without the scan. It takes around 8 weeks to gather all the paperwork. If we cannot proceed with the application because it's a last minute one, we will refer. We will not let anyone hang there. We will call. We will find out if UF is able to do it. If any other research university who does that, we will be able to take the brain. So we will always try to make a referral for our folks because it does matter to us. It does matter research to us, and we will do that for you. Yes, with that said, you can call us here. You can call Barbara. She's our coordinator here. And we work really closely with Mayu and Rachel over there, the coordinator of the brain bank. She's wonderful at Mayo Clinic. She sent us all the packaging that we need to do. We go to the hospital often so we can make sure everything matches. We send all the paperwork to them and also to Mount Sinai Medical Center because they monitor us. The funding that we receive, it's a small fund from the Department of Elder Affairs, so we can do this. And with that said, if you have any questions for us, let me know.
I also providing here some information about, where to find resources about the Mayo Clinic Brain Bank, about the ALS program, autopsy program. Cure PSP is also one of our partners. And particularly, I want to highlight the Mayo Clinic Alzheimer's Disease Research Center, who is a huge partner of us.
So yeah, in the state of Florida, you have like around 13 memory disorder clinics, and we will see that if a doctor or primary say, "Oh, it's only dementia. Everybody gets dementia when they get older." Don't take only that word. Just make sure that you ask which type, okay? Or you go to a memory disorder clinic or to a neurologist or geriatrician. Make sure you get your diagnosed. They will know how to treat you, or your family will know how to behave, how to handle your behavior, how to go to workshops to understand your behavior. So that is very important if you know exactly what type. And Dr. Engelberg, you said some changes that you found out are not observed during the lifetime of the patient. How so? Can you elaborate a little bit about that? You're not able to see the changes when they are at the regular lab, or it's only when we're doing an autopsy we are able to find all those details.
Yeah, these details is only detectable under the microscope by
Mhm.
analyze the brain tissue. So they cannot be seen in while the individual is alive. Of course, by developing imaging biomarkers, by developing blood and CSF biomarkers, what we aim is to be able to detect those changes earlier, even when the individual has no symptoms as a preventive measure. And when there is any kind of risk associated to dementia, but ultimately, we are on the works to get better and better tests that we can use and be reliable. There are, of course, as I mentioned before, techniques, imaging techniques, and even blood and CSF that has been in use, but they're not like the definitive diagnosis. So we still need to do the autopsy brain tissue examination to be able to find all that involves the pathology of that specific individual. And it can be very individualized, those changes. So we need to understand what's happening by looking the cells under the microscope.
Okay. Any questions?
This is Donna. No questions, but I thank you. It's really important information, and we just have to make more and more people aware of this.
Yes. And I have a question for Dr. Engelball. So, Dr. Engelball, why, while the person is alive, they do find that the behavior is related to Alzheimer's disease, but they don't know if it's a mixed dementia. If they don't know, oh, this is Alzheimer's and Lewy body. What what had happened? Why is that?
When the pathology is developing and the symptoms are developing, those changes are localized in certain brain regions. They can be caused by accumulation of amyloid and tau, but that can be Lewy bodies too. So we have a co-pathology playing a role, but it's really not detectable because what we are seeing is the symptomatology. We can use those tests that I just mentioned, imaging and biomarkers, to kind of try to really break down, but it hasn't not been developed for all the pathologies. So the only way to see those changes is still the brain tissue analysis.
Okay. Thank you. Liz has a question. Okay, go ahead.
Hi, I'm sorry, but because we have some time, I was thinking, in sharing this information with your colleagues, it was one thing, right? Because that's a different setting. But if you were to approach this and sharing it more so with loved ones or, peers, with maybe parents that might be exhibiting some of these things, is there a way that you all would suggest to introduce this topic? And I know that, supporting scientific research, that seems like something that's obvious, but I think when it's your loved ones, it's much harder to look at it through that lens. So I just didn't know if you guys had any tips or tricks on, I guess, like an introduction into what it would be to donate your brain for a scientific study, whether that's like for loved ones of someone experiencing it or I guess that person themselves.
That's a great question. And first, I always ask them, are you organ donor? Are
Okay.
you an organ donor? And if their loved one wants to be involved or has just been diagnosed, you can approach that with that angle. Are you an organ donor? Would you like for us, mom or dad or uncle, would you like for us to coordinate with the brain bank, a brain donation, so they can find a cure for in the future? So it will be a great impact in humanity because already they are an organ donor, and when they are affected by any form of dementia, they're not going to do any transplant. The only
Okay.
donation you can do is the brain. So we're not going to waste it because they are an organ donor. You can go with that angle. I don't know if you have another suggestion, Dr. Cook.
Well, what I can share is a very individual decision, even for the family. And I think being aware that that's possible is the first step, and then knowing more and more about the steps to become a donor, but also why I would like to become a donor, or I would like to donate my mom's or my loved one brain
Yeah.
to obtain these autopsy reports, but also to research.
Exactly.
Thank you
And
both so much.
and maybe if it's your parents, their state of mind before, if they were really poor science, they wanted to contribute, if you were aware of it. And like Dr. Cook said, like to have the conversation, you can bring some literature to the family and to the person that was just diagnosed. If they have advanced dementia, they will not be able to make that decision. But the family will know. She talked about donating her organs, or it's on her driver's license. So you have that conversation, and everybody acquire the information from the brain bank, the literature. We'll be able to send that to you, and then that's a decision. We cannot force anyone to be part of it. At least the awareness, like Dr. Cook said, in the family, and the person making the decision in the family as well has to have all the data, and so they can make the right decisions for their family.
Thank you so much. That's really helpful.
All right, Linda.
Yes, my husband, who is a patient who does have Alzheimer's, and I think one of the best things he felt about listening to this was that Mayo Clinic was involved. We have both been patients there for other reasons, and that lends it a great deal of credibility. So if people were trying to approach someone, when I told him that Mayo Clinic was going to be here talking about it, would he like to listen? That meant something.
Well, thank you for sharing this. This is very important to know that our work has a very good impact in the community. And we work daily to strive in doing better and better. Thank you so much.
And also, maybe it will be uh, good for us because not a lot of people are aware of the brain donation as well. So, if we can touch more doctors and organization caring towards a person living with memory issues, and also the support groups and the geriatrician, any doctors to have that information in their clinic or have that discussion, when they find out or when they are caring for their patient, they may have that information as part of their packet to say, okay, just think about it, if you want to. So that will be a good venue as well.
Another research that I want again to highlight is our Alzheimer's Disease Research Center that has a lot of resources that can help not only about brain donation, but also during life. And they have their programs, and you can find further information. I'll share the link so that you can find further information, and maybe that will be also helpful as a resource to further know what is that we do.
Yeah. And you can also reach out to the ADRC. We'll put our information there. If you need any caregiver support, this is what we do. We have a lot of workshops pertaining to caregiving, how to take care of your person. We provide tools and techniques of everyday caregiving, what to say, how to act, and what not to say that could provoke agitation or more delusions, etc. And you can reach out to us as well. We also have the Music Box Initiative, again, with the mind that you can interact with your loved one living with memory issues, where we can provide you with instruments so you can interact with them with a list of music, the genre that they love to listen when they were younger, and that stimulate the brain, that allow them to be happy and interact with you. One thing that we will suggest you is to make sure that the care partner, the caregiver, you're not only giving, but you are a care partner in this journey. If you are a care partner, you need to care for yourself as well. You need to put your oxygen mask. It's very important. You need to socialize. You need to go to your doctor's appointment. You need to interact with people, get a glass of wine with your friend, things like that. And you can also share information with other family members so they can provide you with respite care. Or you can contact the ADRC, where we can provide you with state and federal programs that can support you in your area, because you need to know you're not alone. You cannot go through this journey by yourself. Not only it's costly, it's time consuming, it's stressful. I'm sure that most caregivers can agree with me that their stress level is very high in comparison to before the diagnosis. When a person in your family has been affected with dementia, it's like everyone has been touched by this disease, because it's not an easy task to do as a caregiver, to care and understand how to talk to the person. And I regret we don't have any images. I think we had some images of the brain, but when you see the brain shrinking, like comparison to a normal brain, you understand that why you cannot say to somebody, do you remember? Because they can't. And that creates frustration if we do, because they're going to argue with us and they will not like us anymore. We'll be the enemy and the bad guy. So this type of research and also the brain scan allow us to care better for the loved ones. What they find out allow us to be able to understand their behavior, and and give the tools to the caregiver how to handle them better. And you can call us so we can give you those tools if you have any situation.
Any kind of difficult situations or decision-making situation, it is very important to communicate, to talk to your family, to your loved ones, to talk to others, to look for resources to interact with others in the same situation. That all helps. As Alexandra pointed out, you cannot feel like you are alone. You are not.
No. And it's important as well when you see the behavior to take notes. Like she said, don't be silent. Take notes. When this happened? Did it happen when I provided the medicine? Does it happen at a certain time of the day? Did it happen because she was, it was late at night, or she heard a noise or something? And you take notes and you share that with the psychiatrist, with the neuropsychologist, or anyone in the medical field to explain that is following your loved one, to explain this is what happened, and they'll be able to assist you. The elder helpline, all the in the state of Florida and other area, they have area agency on aging. In Florida, we do have 11 area agency on aging. So again, you don't feel alone. You can reach out to them to see what type of respite care they can help. They can assist you with, or if you need to go to a daycare center, or have some respite care at home, they'll be able to help you or guide you. Just keep in mind their all priority list. It's not like immediately you'll be able to receive assistance if you need help. I don't see any other questions. Dr. Cook, would you like to say something else to close our session?
Oh, I just want to thank you for the opportunity of being here with you and share part of my work. It's important to me. I am also a daughter and a granddaughter of Alzheimer's disease cases, you know.
Mhm.
So I understand the process that we go through. It's really not easy. And that's why I decided to move to this area of research to try to contribute as much as I can for the cure or for stopping this disease.
Thank you. And we're here too. Barbara and I, we have been touching our families with this form of disease. And we are trying our best to educate people, to help them to the best of our abilities, to find resources, not only in Florida, but in the entire United States. We provide all the resources that we can to help families. With that said, we say thank you for joining us. Thank you for being here. If you're here, it's because you care and you want to share that information with somebody else or with your family or with clients. Until then, feel free to call us or email me. We'll be glad to assist you. Thank you, doctor, and talk to you
Thank
soon.
you. Thank you. Thank you all.